she. Go to the one another home. Shina, Mani kina, Ian kina home chow. Don't know when Otabu, Panteah. Hello. My name is Panteah, the governor for the Zuni Pueblo. We're here through this live stream to present updated information and some recommendations on the recent changes with COVID-19. Today, we're going to be presenting two speakers. One of them is going to be a special guest, Dr. Ryan from our Zuni PHS. Dr. Ryan, now in this hospital and the other guest that we're going to have is Lieutenant Charles Leekity. He's an emergency manager. Just recently promoted to this position. And before we go any further, I want to recognize the former previous emergency manager, Dion Lalio. I want to just thank him for his dedication and work as an emergency manager. And with Lieutenant Leekity, I am impressed with his commitment to carry on the responsibilities as emergency manager. And so with that, I'm going to go ahead and allow our guest, Dr. Ryan, to speak to you about some of the things coming from our Indian Health Service Hospital.
Hello, good afternoon. My name is Rebecca Ryan. I am a physician and the Director of Community Health up at Zuni IHS. And I wanted to give an update about COVID-19 in the community. As I'm sure a lot of you have heard, with the Delta variant, within the past few weeks, we have been seeing more cases of COVID-19. In the past 2 weeks, we have had a total of 16 new positive cases. And over 40 of those were in people who are fully vaccinated. And I bring this up for a couple of reasons. One is that I want to point out that it is true that the vaccine is not 100% at preventing COVID infections, but it is still doing exactly what we want it to be doing, in that people who are getting COVID now, who are fully vaccinated, are not getting very sick. The whole goal of the vaccine was to prevent hospitalizations and to prevent people from dying. And this vaccine is still extremely effective at doing that. So we actually have no people currently admitted in the hospital with COVID. I do think it's worth remembering, though, that as we see more cases, we do need to recognize that continuing to practice safety precautions are important, including wearing masks, especially indoors, and trying to avoid large groups of people. I also wanted to mention, I know some people have been worried. There have been some children who have had COVID within the past several months. I think the schools have been doing a phenomenal job at keeping our kids safe. And we have actually not seen a single child who has gotten COVID from school. Every single case of COVID we've seen in kids, they've acquired it at home. I also wanted to talk a little bit more about the COVID vaccine. There are 3 different ones now. There's the Pfizer, the Moderna, and the Johnson & Johnson single-dose vaccine. There's been a lot of talk lately about boosters, and I know it's pretty confusing about who qualifies for what, so I wanted to clarify that. The Pfizer vaccine has been approved for booster doses. So if you have had the Pfizer vaccine and it has been at least 6 months, then you might qualify for a booster. The qualifications are anyone who is 65 and older, or anyone 18 to 65 who has underlying health conditions. And that can be essentially like any underlying health condition. So if you meet any of those criteria, you can get a Pfizer booster up at the hospital Friday afternoons, either as a scheduled appointment or a walk-in, or at any one of the community events that are held down at the fairgrounds. The other group of people that qualifies for a booster of any kind are people who are immunocompromised. So people who have like a kidney transplant, anyone who has active cancer, or are on very strong immunosuppressive medications. And as you probably know, the Pfizer vaccine is also approved for kids 12 and over, and we do strongly encourage to get kids vaccinated as well. A couple of other updates. Moderna and Johnson & Johnson are currently in the discussion phase with the CDC, the Center for Disease Control, and the FDA. So those will probably be approved for booster doses within the next few weeks, but stay tuned, we'll keep you updated about that. The other group that I know people have had a lot of questions about is Pfizer vaccines for kids under 12. Our hope is that that is going to be approved for kids 5 to 12 years of age within the next few weeks, hopefully in November. And up at the hospital, we're already getting ready to provide these vaccines once we have approval. And the final point I wanted to talk about was with testing. I just wanted to remind people that if you have been exposed to someone with COVID, then we do recommend getting tested 3 to 5 days after your exposure. It is important to wait for that period of time so that if you are positive, it'll be enough time for that to show up on the test. We are doing testing at the hospital from 8:30 a.m. to 11:30 a.m. Monday through Friday. And that is all I have prepared.
Good afternoon. My name is Charles Leekity. I am the Tribal Emergency Operations Manager. A little bit about my background is I've been a member with the Department of Public Safety for approximately 27 years. 20 of those years were with Zuni Fire EMS as a frontline provider. As Governor mentioned, I am the emergency manager, and just to list some of my responsibilities, as an emergency manager, I have to identify and address some of the various threats that do come into the community as far as emergencies, natural disasters, and so on. So for me to act in this capacity, I do attend the ART Action Response Team meetings within the hospital, weekly meetings that is conducted. And I do speak with Dr. Ryan and Dr. Faber, as well as other hospital staff. And it was mentioned that there was a significant increase in breakthrough cases. This was so concerning that I needed to notify our governor, and this allowed us to come to this day as far as we needed to give this information to the public. There is a lot of confusion, there is a lot of fear within our community, but hopefully with this live stream, we can answer some of those questions and put some people's mind at ease. So another part of my responsibilities is I am the point of contact for the McKinley County, state, federal, and private entities. This comes into play just because of resources that we can provide to our community and through the approval of the governor. And with that said, we felt that we needed to give more information to the public. We really wanted to refrain from experiencing another year that we all did last year in 2020, as far as the first case of COVID, to the point where everybody was in fear. And sometimes it does feel to that point where everybody does have that mindset. But right now, with the information that Dr. Ryan and Dr. Faber and other entities as far as CDC, they're providing a lot of useful information, and we're here to provide a lot more information that we can support so many others. So with the increase of numbers, the research and the information that was received from the hospital, the rise in breakthrough cases was actually from community members that were attending traditional wakes, and they were unmasked, and this led to the spread of COVID. So, I'm sorry, with variants and breakthrough cases. And this actually served the rise in those numbers as well. So another issue that was brought up by the hospital was there are some individuals that have not been vaccinated. These individuals are still at very much high risk on getting the virus and seeking for medical attention. And another point was the community members who tested positive need to refrain from interacting with the community. If they are tested positive, they need to stay isolated until the recommended CDC guidelines. I believe it was 10 days, correct? Okay, like everything else, a lot of recommendations are being changed daily. So we're trying to keep track with those updates, and we'll get them to everybody as soon as we can. Another point that I wanted to address to everyone was that we do have our call center that is still active, and their contact number is 782-7114. We'll get that information out to our website as far as POZ. Some of these questions that come up can be answered by the dedicated ladies that are up there right now answering the phone calls. Some of the services that they can provide is picking up and even sometimes delivering cleaning supplies, sanitation supplies, anything that can be used to sanitize the house, any kind of furniture. And right now, we're waiting for the tribe to approve the wood assistance for the upcoming months. They're going to be utilized as well. Point of contact will be that call center. Should any community members, family members that need to warm their houses and keep warm through the coming winter months, they will be on hand to take in the request. Also, another information that they do information that they do provide is vaccination events. They are updated by the hospital. They have the dates, the times, and the locations that will be provided at community events. They can provide that information, as well as another portion that they do provide is emotional support. As a frontline provider, we witnessed this really frequently last year, and it takes a toll on everybody. And emotional support, if people that are tested positive need to talk to somebody, these ladies can help. So please feel free to utilize that phone line. Again, it's 782-7114. And that's all I have, I believe. Thank you.
Okay, I believe there's a question about testing frequency and if there's a limit to the number of times a person can be tested. The answer to that is no. I would just keep in mind when it's most helpful to get tested, which is at least 3 days after an exposure. If you do it too soon, it won't be an effective test. But there is no limit. The other thing that I wanted to mention, I think is really important, especially as we're coming up on winter, is the importance of getting a flu vaccine. We have been strongly encouraging everyone to get COVID vaccines, but we also are strongly encouraging flu vaccines as well. And we're doing flu vaccines up at the hospital, also on Friday afternoons and at all of the community events. You can get your COVID vaccine and flu vaccine all at the same time.
Okay. Well, thank you, Dr. Ryan, Lieutenant Leekity, for all the information that you provided. It's very helpful to make sure that we all understand, what we're dealing with, what we're faced with, with COVID-19 and the Delta variant. And as Lieutenant mentioned that, he did bring to our attention, the Governor and Tribal Council, the increasing numbers. And mainam is te uso now and look at where can yalinan is ampikoin na is list archipeko hosnos list na EU chino na hungkat lesna chuanap antehlap chikot lesna hapon wake le usi traditional wake isnokon lesna hungkat hapon ante kwa mask awali wamen emmona ma telito atsana ko emman uppap hungkat isnokon iupcha ta istonkat ista hona topa jatinenakten hungkat hoslos itowan na ko ta lesna kwa ja mask awali wamen ta isnokon hungkat iupcha le konchi ko to nawan lesna pena ukwatelap. You know, one of the things that, you know, we are always aware of and made aware of is, you know, where these infections are occurring. As I mentioned, you know, during our traditional wakes, and Lieutenant Leekity mentioned that that's one of the areas. And the other thing is our cooking. Hold down, listen, elatenat ketean lukya ma lesna tennas itowan na ko lesna hungkot emma haponan kwa yames kawuli wamen kuplad ma lesna, you know, telito atana ko lesna emmo nupopop ma ten chua lesna hungkot wenan te chip ma an emmo na iyup janna usona tomton lukya yaton tona hon ema hungkot lesna chua an kakwan ito wan na tacha kwa hongkat ho na wan teusu kwa lesna haitos na yoab maulachi lukno hongkat is olsha lagani kwa lawan ito wan nuap lesna ma awan kakwani kowa wan pa le na tea shukwa tacha hongkat tom tishon kakwano na te chiwan hon ito was na hongkat to ito was ni han yam kakwan to ito was nan to like wupo niya kwa ko le shukole kopte ta iston to hap ihati ap ma hame hongkat kwa les ande shman kwa les na te ame le kon songkat lak ma chot les na ito an kapan ito onas ko i antikon ko le hongkat awan pena kwa koksham les na ihati ap kwa les na te shukatishma ha tom songkat les na chua le na te kanna ho na hongkat chi Deus ahoi kwa le na haitos na yo le na teka na le ko toms to na wan penan ayu shashike na wa akke kwa ko le shuko la iskon hungkat ko le ma tenas lesna haitos na yo hon ansam hon I willa pa hon I kwani kan hon I willa pa hon I ayu pachi hon atikan na usona lagi to na ho le na awan penia kwa ista lukya se sho na on yalle na emma kwa to non ates lakke na omme tom tu si ma hungkat ma koana ma hon lukya hon is akitetse mateng is COVID asheta ma emmon hon na wan aho awetik hon emma aho itosake hungkat tem lesna hon na wan sema kuite onakke ho nawan le yalle na emma hana ha tas on le kon awan le kon hongkot emmo na le nawan tema kuyo isto nawan ma akwa mossi beke kwa etista ashe awet chona male kwa cholista hospital animok na male kwa ta cho tema kwa ista yu hetam melukya weakke attanni hongko kwa to lesna vaccine kwa to usana ki lawik na ma hongkatto lukya wea kiate ma temish attanni usona lesna teo nakke tomson iya yupachiwa on le na ma iya yushashike na kwa le na on haitos na le na yohanna usona on ansammo on iya yupachiwa isma lukya yaton hotta ko awan tewa is chekwat emmon apenan ho usi ipekke kwa lagi hon usona sakke lesna anselem kwa uso lesna tishkole ko teshuka hon iashuap kisto na on janulla hon iashuap kakkepish emmona kopslatinna lukkes anselem awallunna lekon ho nawan pena kwatela on iashuap ma ama lakiam sakista kwe ama jantikkuna napshe kople awan tsema kwiwe akisto nawan anul anan ashu ka aji ashu ma hongko wan le na tap elekan na le ko akke ista ho na yatin ap ke ko si sana anang kwas pi mele ko ma ista ko pe ko toms wan ia yu la shiken up she ele tonona ho na wan a ho ko la ki ko le a wetinam tonona usana ho itse manna akke ples ansele ma oluk ma chiko chito te kona wa ko to ye lesna ansele mo geptum analtihna hame ho na wan a shina dem hong ko lesna look at where ki am ko lo tunap ko akke ana kwa ho kwaina maniha le kona wan sema kuita kwa ta uso ko awan ishta tik kun chua et le na ma pocha se mashikwa kwa ta ko awan ni kwa te shikwa uso na tomta on lesna ia yusla shikena kwa e ko le shikwa la look at ta ma li ho na wan ibu yo an ma sto na wan dikya wa ko ibu yo ta les declare hong ko kwa le na tom lewi look no hapon na le na tekan na le ko ma o sachi uson awan penan ne kwa lu si look ya ta pu anuslan emergency management hospital kwa awan uson na kwa penan te amme ho na wan deus a ho lesna yamante kwa hong ko haitos na ashnaw tom son awan yu shashikena. You know, during these times with religious activities, I just want to say that, you know, any determinations or restrictions that are imposed by our religious leaders is not decisions by the tribal council, the emergency manager, or our hospital. We only make recommendations. And if they decide that this is some of the restrictions that they want to impose, please just respect those decisions because themselves want to keep our people safe and healthy. And also not less nak ape tom sisto ko peko tom sonia yu shashikena. Lasta is tame chekot apenan kuplable na honyam look at kwa haitos na sila me hame lesna games and ko concerts kalapa ko alo ke ko lesna awallo le ko usana ma chikot hotse ma yamante to na ho hongkat ton lesna hosnos awal na ton iwas lipanna yamante usana ton yamse ma kwinna ke lesna ton iwas lipap kwa kolis kon ta ho na wan penante amme toms ton yayu pachiwa lesna hongkat ho ikerto iskon akshiken hiap ishalte ma eten hongkat chikwa cholyam mesk awuli omme to yam ele tununa kwa to wenan yatenam tuno nakke to mesk uliken kwa ta chole tom ko ani kwashko kwa tom ko anashko usona ton yamante usona ton itse manan lesna ton iwoslipap kwa ko le shko la ista lukya ma lotte mana mas Halloween yo an kwa te muso ko chola ke ko likwena le tewa usitemsha le na ho na ulo na kwa one Halloween atishko kwa chol is no trick or treat kan allushko trick or treat kan allushko le kon usona lesna penang kwa tem chol ko likwena lesna te ona ki ma osha chito no to na ho hongkot kwa ton lesna hongkot ho tesla na kwa one usan awan altishko le ko usona tachi awan lesna tsema kuitekan that hongkot ma ton chawi lapon one se som chawi one ko usi trick or treat awan lu shukole ko that usona to na wan ma se ma kuin to na wan sam kwa usona ta chol lesna kwa iskon lesna ipena temi ma usi lukya ma on ma pe ke ma hongo kwa lesna ton itek kunawe tia nan you know ista ho na wan governor's office the like fire department Lieutenant Leekity uchan hongo ma ista Dr. Ryan Beck hongo kwa lesna ton itek kunawe tia nan iskon ton le kunawan penan agina call center iskon da lesna kwa information lesna to hongo yala ken here ton lek on call at tinawa ma ela ko ma I lukya ta te wanan ta to na hon awashu apke tom ton isto kope ko kwa lista to na kin a teslak na me tom yam a ho kwa lawan ele to na hon ansam ma lukya wea kish tem ma chikot allu kwa ho na awante wana lesna te ona ke tom son iya yu pachi on iya yu lashikana lesna hon a te ke na tishama hom a ho So we shared a lot of information today, and I really appreciate, our two speakers. And I also want to extend our appreciation to ShiwiSun, the productions for making this live stream possible. And I believe it's going to be aired on Keshi. So we want to thank all our staff over at the Keshi radio station. I don't know if you knew, but now we're live streaming. You can actually catch the radio station on your device, your phone, or your computer. So I think those are some of the advances that we've made to make it possible that when we do have information to share, that we have those technical, I guess, opportunities to make sure that we spread the message to all of our community as well as to the outside. So again, Dishamaha. Please, let's all work together to protect one another. And most of all, if you're not vaccinated, get vaccinated. Aki hongat isko na maachpeko, hongat vaccinated ina. Look at where keto yate pa etishtatum ashe. Look at where palis and symptoms la awan tikan uksa pato suffer at the sugar. So with that, thank you again. And I want to wish everybody a good day. Malewi, yatong gokshi sunna kenaptu ela kwa.